One of the novel things about the PHIA project is that we're also collecting these HIV biomarkers in children, and that really didn't exist before. Most of the surveys, all the surveys before, really only started at age 15. And we now have data for the 0 to 14-year-olds, and that is going to have a very big impact, because we'll have a much better understanding of how many children are out there, and so far it looks like there are more than we thought, and how they're doing with viral load suppression. And you can imagine it's harder for children to take their medications every day. We recently released PHIA data, for example, from Malawi, that showed there were 50% more children than had been previously known. 120,000 children in Malawi living with HIV instead of the 80,000 that had been estimated based on models. That's a very substantial difference. In addition, from that same Malawi PHIA or MPHIA study, we found that the rate of viral suppression in children is very low, well under 50%. So there's a lot of room for improvement, and clinicians and parents and policymakers need to think of innovative ways to help children adhere to their treatment. I know one of the exciting things going on here at the conference, for example, is the presentation on Latte 2 with 2 long-acting injectables as antiretroviral treatment. I would love to see injectables be available for children, and then they wouldn't have to take pills every day. So that is another important aspect of the PHIA project, all of the pediatric data, and really shining a light in areas that we just didn't have before. Another area that the PHIA project can look at are related biomarkers. So we're also collecting syphilis tests, and in some countries hepatitis B tests. So we'll have population-based data and be able to see how often people with HIV are co-infected with active syphilis, and I don't mean inactive latent infections, but active infections, and how often they have hepatitis B surface antigen or a sign of chronic hepatitis B. So this will be very valuable data, and each country will be left with a biorepository of nationally representative samples for future research.